Listen to me. I want you to stop what you are doing right now, pull up a chair, and pay very close attention to what I am about to tell you. Because what we are talking about today can quietly bleed your retirement savings dry month after month, year after year, for the rest of your life. We are talking about Medicare Late Enrollment Penalties. Now, I know when you think about turning 65, you think about freedom, you think about finally stepping away from the daily grind, enjoying your hard-earned money, and relaxing. But then the mail starts coming. Stack upon stack of Medicare flyers, confusing rules, endless fine print. And so many of you, and I see this happen to smart, hard-working people every single day, you get overwhelmed. You throw the paperwork on the kitchen table, you say, I'll deal with this later, I'm still healthy, I don't need doctor visits right now, I'll sign up when I actually need it. Stop right there. That single line of thinking is one of the absolute biggest financial traps in healthcare. Medicare is not like private insurance where you can just jump on and off whenever you feel like it. Medicare has strict, uncompromising rules and brutal deadlines. If you miss your enrollment window and you do not have specific, qualified coverage in place, the government will penalize you. And here is the kicker that makes my blood boil because so many people do not realize it: these penalties are not a one-time late fee. This is not like paying a $20 fee because your credit card payment was 2 days late. In most cases, Medicare late enrollment penalties are permanent. You will pay them every single month, added to your premium, for as long as you live. Think about what that means. Every single year, when your cost of living goes up, that penalty goes up right along with it. You are literally volunteering to pay a lifelong tax on your healthcare simply because you missed a date on a calendar. So let us break this down so you understand exactly what you are facing, how these penalties work, and most importantly, how you stand up, take control, and protect your money. First, let us talk about Medicare Part A. Part A is your hospital insurance. For most Americans who have worked and paid Medicare taxes for at least 10 years, or 40 quarters, Part A is premium-free. You paid for it during your working years. But if you did not hit those work credits and you have to pay for Part A, missing your enrollment deadline means a 10% penalty added to your monthly Part A premium. And you have to pay that penalty for twice the number of years you delayed signing up. If you waited 2 years, you pay that inflated cost for 4 full years. Now let us look at Medicare Part B, which covers your doctor visits, outpatient care, and medical tests. This is where the vast majority of people get hurt. If you miss your initial enrollment period, which starts 3 months before the month you turn 65, includes your birth month, and ends 3 months after, and you do not have employer coverage that qualifies, you face a 10% penalty for every single 12-month period you were eligible but didn't sign up. Let me make this crystal clear with real numbers. If you delay signing up for Part B for 2 years, that is a 20% penalty stacked on top of your standard monthly Part B premium. If the base premium is around $200 a month, you are paying an extra $40 or more every single month. That is hundreds of dollars every year pulled right out of your wallet, for the rest of your life. Over a 20-year retirement, that mistake costs you thousands upon thousands of dollars that should have gone to your trips, your grandchildren, your peace of mind. And then there is Medicare Part D, your prescription drug coverage. So many people say to me, Susie, I don't take any prescription drugs. Why on earth would I pay for Part D right now? Listen to me. It does not matter if you are taking 0 prescription medications today. If you go 63 consecutive days or more after your initial period without Part D or what Medicare calls creditable drug coverage, you trigger the Part D late enrollment penalty. The calculation for Part D is 1% of the national base beneficiary premium multiplied by the number of full uncovered months you went without coverage. That amount gets rounded and added to your monthly drug plan premium forever. 5 years without drug coverage? That is a 60% penalty added to your bill for life. And when you get older and suddenly need expensive maintenance medications, you will be forced to enroll, and you will be slapped with that penalty on day one. Now, you might be asking, what if I am still working at age 65? Am I trapped? This is the question that trips up millions of retirees. The answer is, if you or your spouse are still actively working and you have health insurance through that active employment at a company with 20 or more employees, you can delay Part B and Part D without a penalty. You get what is called a Special Enrollment Period that gives you an 8-month window to sign up for Part B once that job or coverage ends. COBRA will not shield you from the Medicare Late Enrollment Penalty. When that COBRA ends, Medicare will look at you and say, "You missed your window," and those lifetime penalties will kick in immediately. So what is your actionable takeaway today? What do you need to do right now to stand in your power and protect your financial security? First, mark your calendar 6 months before your 65th birthday. Know your initial enrollment period dates like the back of your hand, 3 months before your 65th birthday month, the month of, and 3 months after. Second, if you are working past 65, do not guess. Ask your Human Resources Department for written proof that your current health coverage is considered creditable coverage for both Part B and Part D, get it in writing and keep it in a safe folder. Third, even if you are totally healthy and take no medications, enroll in at least a low-cost Medicare Part D prescription plan or a Medicare Advantage plan that includes drug coverage during your initial window. Treat it like an insurance policy against lifetime penalties. You have worked too hard, saved too diligently, and sacrificed too much to let bureaucratic fine print steal your retirement security. Take control of your healthcare enrollment today, make the right moves on time, and keep your hard-earned money right where it belongs, in your hands.